Good. I like freebies. All right. I'm going to have you adjust me afterwards, too. It's been a long week. Tony, nice to meet you.
Joel.
Joel, nice to meet you. Where do you practice?
In Tarzan.
All right. Okay. A little dry for you, too. Cool. What's going on today?
Left hip. You know, I adjust like this thing.
Boom.
The right shoulder's just jacked.
Which one on the shoulder? Grab your stuff on the table, too. Your phone or whatever in your pocket. There you go. What's with the shoulder? I tore my shoulder before, too. What happened?
I was doing a side
Give me a story. Okay.
Patient didn't come all the way over, and I was being sloppy, and I was just...
Got too far over the elbow?
And then just...
And is it more the front or the back?
It was in front. It's getting better.
Okay. How long ago? A couple months? Okay. How do you stretch it? What do you do for stretching?
Well, I still rehab this thing, so I
go
through all the ranges. I got full range of motion.
Okay.
It's just,
is it more, you think it's more pec minor, anterior delt, bicipital tendon?
bicipital tendon for sure.
More this motion? Okay.
Yeah.
Okay.
So anytime I do like shoulder presses.
You still work out, right?
Yes.
Oh, yeah, good. Have to.
But the day after I do shoulders, this thing's pissed. And then I get a little clicking in there, too, so.
Okay. And how about if you rotate your hand out this way? Does that feel good?
Not really.
Yeah. So tight. Where do you feel it?
I feel it tight.
Posterior delt? Okay. I'll adjust your shoulder afterwards, see if you're okay with that. How do you stretch your shoulder? What do you normally, what's your routine?
Well, I go through all the ranges of motion. So I'll
Good.
Go here, I'll go thumbs up, lateral,
Boom.
thumbs down. So I'll hit all those ranges of motion, and then my workouts have been very lightweight.
Yeah, try to get a little rehab. It's going to happen. I tore mine before, too. Yeah. Do you do this broomstick stretch, too? Broomstick? That's what I would do. I tell my patients, that's what I give my patients. Broomstick, go as wide as you can. Go far back where it feels comfortable. Hold for 5 seconds. Come back for, tell them do it 5 times. Hold for 5 seconds. Give resistance band too. And it just takes time, man. You'll get there.
It's gotten better.
Good.
Believe me, over
Icing
the last
too?
few months, it's gotten, yeah.
Good. Isn't it amazing? It works. Been around for millions of years, ice pack. Still works. On your back for me first, face up. You said more of the left hip, right hip?
That left.
Okay.
That's the one I kind of lead.
You work solo?
I do.
Perfect. On your back. Get your money's worth today.
No, but my wife's a chiropractor.
Okay.
She's right there, so it's
There you go. It's always her. I'll take care of him for you. Like a little extra for you. So right now, higher, lower. It's a little tighter on that left side. Okay. So as I tell my patients, it would be more of the left hip being here and the right hip being dropped. So you don't wear a lift in your shoe, correct?
I do.
Okay. How do you stretch your hip?
I'll do forward lunges.
Okay.
And then I'll do that rotation psoas.
Perfect.
As well.
Okay.
Pull on the quads. I'll do. This is my warm up for varsity patients, and I'll squat and try to.
Perfect.
Adductors and do side lunges.
Boom. You got it all down. Try this one too, Joel. Bring your leg off the side. Bring your foot back here.
Oh, yes, sir.
How's that feel?
Yeah.
This is I call it hip flexor stretch. It gets the quad below the knee, as we all know. Quad attaches below the knee. Hip inside, psoas goes to the below back. Also, hits the side joint. In fact, it gets the whole hip to kind of rotate back to neutral instead of being more posterior. I tell patients going backwards. Just use common knowledge. Easy stuff, right? I tell my patients hold this for about 1 full minute, Joel. At that point, give the ligaments time to stretch. How do ligaments and muscles stretch differently? How would you tell your patients that? I tell my patients muscles need the movement to stretch. Ligaments need that tension under time stretch. So I tell my patients hold this for at least a minute. And what are they going to do for a minute? They're not going to do a minute. They're going to do like maybe 30 seconds. I always give them longer so they give them some leeway to see the actual result, correct? Okay? So I tell them to do it at least 3 times on one side. They'll do it probably once. People are lazy. So all I want is once, but I tell them 3 just so they get the 1 in. Kind of work with their mentality, what's going on. So draw at least 1 time on this side. And when you do lower body squats, deadlifts, lunges, do you do a stretch between sets?
I try to.
Okay.
Like if anything, my favorite stretch is just a forward flexion.
Boom. Okay.
The hamstrings.
Get things to drop a little bit too. So I have patients do, so that's like this to actual leg, is even to have, especially chronically, have them go do a lunge stretch and just lean forward a little bit and come back up for about 10 seconds between sets. That's what I do for myself too, because mine is more the right side. Is I'll have them come forward and lean back to feel that 10-second stretch on both hips so they're working out, even not here. For yours, even not here. What happened during COVID when the gyms closed? Did you guys see more people or less people when the gyms closed? Well, actually when they reopened? More people, right? Why? People went back to the gym during COVID. They want to go back to that weight they did 6 months ago. So job security, we had more people. The first year after COVID, after the gyms reopened, I saw 23 bad back injuries just from people deadlifting. Because they didn't want to start over. So they started with like this too, same thing. They had a bad hip, and all started lifting weights. It get worse. What happens when you over rotate your hips or overextend your hips? Torque in your low back, L5, S1, L4, L5, pops that disc. Boom. Guys and girls, everybody. Not gender specific, I guess. So this will allow someone to get that hip stretch in there, 10 seconds both sides, Joel, to map that hip to work out even, maybe even cardio too. So they stay here, not here. Helps a lot of people. All right? Anything else?
No, we're good.
All right, bring your leg up, sir. Do you stretch every day then?
Oh, yeah.
Yes.
Yeah.
I get up before 15 every morning, stretch for 15 minutes before I do anything. I can't leave the house without stretching and my cup of coffee.
Yes.
I won't make it to my office. I don't know how to get there.
First in office.
There you go. Have to. Why is, and there's another thing too, why is staying healthy yourself important? We all know. As long as you want, right? The chiropractor I took over for I brought into the practice, he went out because he had a bad back. I know. We have to take care of ourselves first to take care of our patients. We have to work out, stretch. We have to be the best example for our patients because we do it ourselves. When we do that, does that build up our character, more reputation? Yes. Who wants to come to the chiropractor when they can't even move themselves? No, nobody does. All right, so okay, adjusted. Enough talking. You have any problems relaxing? You're good.
Okay.
Even if your wife's in the room? It's okay? Okay, good.
She
Right here.
ignores me half the time.
Well, I thought they're all the same. Deep breath in, all the way out. Right here, all the way over. Easy. Deep breath in, all the way out. Piece of cake, piece of cake. Are you guys aggressive when you adjust people? Just move bones? Why do you, I tell my patients I'm aggressive, especially with new patients, because I have good malpractice. I'm covered. You guys have the 1 million, 3 million coverage? You know, it works. They go, that doesn't help me, doc. Like, it helps me feel better. You know, it just, you find a way to help relax the patient, and sometimes they'll laugh, sometimes they go, oh, okay, well, you gotta kind of read the room, I guess. Or if you have a problem in the neck and it's consistent, they go, I think I'll tell someone, it's probably just a tumor. You know, you have good life insurance, you'll be fine. Questions? Gotta find a joke for your patients. Now, what I do too, and I'll show you guys on that side, I always, and same thing with yours too, when I adjust someone, I always use the table to help me. So I put my leg on the table, because if I'm here over Joel, what's gonna happen? Ow, hamstring pull, okay? Without the table. If I'm with the table, now all the pressure is on my leg, I can move wherever I wanna go, it doesn't affect my back or my leg. So use whatever you have to keep yourself healthy for the long run. And I'm a right-sided guy, so I'm gonna go right here, Joel. Take a deep breath in, all the way out. There we go. Deep breath in, deep breath in, all the way out. And which shoulder am I using? Is good shoulder or is bad shoulder right now? Is good one here. Okay, just my head. So I always tell the patient, you have a bad shoulder. I want the good shoulder on top for leverage, not the bad shoulder. So I can cause more injury. I don't torture you, Joel. All right, all good. So on your side this way for me. Headrest I don't think doesn't move, so I don't want to mess it up. I don't know. I don't want to mess with it. Right there. What I do is have people drop their leg here. What do you think that does, Joel?
Rotates me a little more.
Rotates you more if they're comfortable with that. So I'm not doing this. I can drop straight down with my own body to get that area to move. And what I do too, because I'm 51, I use more my forearm here on their SI and lower back than direct contact. All right. I want to save my body too. There we go. Other side for me too. Is that okay?
Yes.
Good. That's all the pressure on the same thing here. I'm going to put my leg on the table. Leg drop for me, Joel. Good range of motion. Lift that foot if you can't touch the floor. Hold that right there. It helps relax the leg, the hamstring, the back. Take a deep breath in. Relax your head for me. Boom, just like that. Good. And then grab a seat for me. Watch that shoulder. Right there. I'll adjust your good shoulder first. Let's go to your left. Bring your left hand to your left ear. Perfect. Good. You know your left and right. I sometimes get confused. Bring your elbow in. Eye contact for the elbow adjustment. Just cup the olecranon process, is that right? Right. The elbow. Hand over top. I want to put his shoulder in my chest. I'm going to come straight back. I'm going to hold the pressure first. Take a deep breath in, Joel. Bring your head back for me. There we go. Real simple. Not bad. Sometimes I'll do based on range of motion. I'll bring the shoulder back too, just to cavitate a little bit of that AC joint, just like that. All right. This side a little bit easier. So we're going to test it first. Bring your right hand to your right ear. Elbow in. Before I adjust them, add some pressure. How does that feel?
Good.
Good right there. Take a deep breath in. Real simple. Light one first. Right there. Is that okay?
It was okay.
And then up here too. Right here. Deep breath in. All the way out. Simple. All right. Work on the range of motion, my friend.
Yeah.
You'll get there. It's just time. You know, I tore mine in chiropractic school.
Yeah.
First quarter. Bench pressing. Stupid. All right? Any questions?
Oh, good.
Good. All right. Tell your wife to watch your wallet. I'll take tips. Take your wallet with you.
It's empty anyway.
What's that?
It's empty anyway.
Oh, yeah, I know. It makes sense. It makes sense. Any questions at all? It's making your treatments effective, especially your first visit. I tell patients after your first visit, toward the end, I always go, this is your longest visit ever.